HPV and oropharyngeal cancer. Know the risks, spot the signs. HPV stands for human papillomavirus, a virus that lives and multiplies in skin and mucous cells, such as those in and around the nose and genital tract. HPV is the most common STI in the UK, affecting 75% of sexually active females. It is also the only STI that affects more men than women. Vaccination programs to prevent HPV infection are available for females in many high-income countries, but the same programs do not exist for males in many of these countries. Men who have sex with men are particularly at risk of HPV compared to heterosexual men, who are protected to a degree if their female partner has had a vaccine. There are over 100 different HPV types with overlapping characteristics. Some of the better understood strains include HPV 1 and 2, which can cause verrucas and common warts, and HPV 6 and 11, which can cause warts on the anus, genitals, and voice box. In recent years, around a dozen high-risk HPV types have been identified as one of the most important infectious causes of cancer, responsible for an estimated 4.6% of cancer cases worldwide. In particular, HPV 16 and HPV 18 cause around 90% of HPV-positive cancer. This includes cancer of the anus and rectum or back passage, penis, vulva, vagina, and, perhaps most well known, cancer of the cervix or neck of womb. HPV has also been associated with throat cancer, which is known as cancer of the oropharynx or oropharyngeal cancer, and includes cancers in the base of the tongue and tonsils. Across all these cancer types, it is estimated that more than 3/4 of cases are caused by HPV infection. Cervical cancer has, for many decades, been the most common of these cancers, and is almost always caused by HPV. But in developed countries, oropharyngeal cancer, though much less well known, now represents a comparable disease burden. The contrast between cervical and oropharyngeal cancer trends in developed countries is dramatic. Looking at historical data in the United States, 50 years ago, cervical cancer caused more than 17 cancer cases per 100,000 women, over 5 times the incidence of oropharyngeal cancer per 100,000 men and women. Since that time, cervical cancer rates in these areas have fallen sharply, mostly as a result of pap smear screening programs to detect precancerous changes in cervical cancer. But these successes have been offset by climbing rates of oropharyngeal cancer, where there are no such screening programs. Oropharyngeal cancer rates are rising particularly quickly in men. Over 80% of oropharyngeal cancer cases now occur in males, though awareness of this phenomenon remains low. Analysis of the latest data from the US National Cancer Institute SEER program shows that male oropharyngeal cancer rates have overtaken cervical cancer rates, and the burden of oropharyngeal cancer in men now exceeds that of cervical cancer in women. Specific treatments exist for HPV-positive oropharyngeal cancer, and survival is better than for other types of oropharyngeal cancer. However, while more evidence is needed to determine efficacy in the prevention of oropharyngeal cancer, the evidence from cervical cancer rates suggests that vaccination and screening is the key to reducing the impact of the disease. Here's the HPV life cycle in a high-risk individual. Statistically, that's most likely to be a Caucasian male of higher socioeconomic class, although of course HPV can infect anyone, and indeed does infect most people. With each new sex or oral sex partner, it becomes increasingly likely that HPV will catch up with him. The risk of HPV infection is increased by having many sex or oral sex partners and early age of first intercourse, by not using condoms or oral dams, though neither is 100% effective, as contact with the skin around the genital area can spread the virus, and also for partners of females with a known history of HPV-positive cervical cancer. When HPV is contracted, the symptoms depend on the subtype. It is at this point that he may develop warts on the genitals, mouth, or voice box, but most commonly he will experience no symptoms at all. And of course, when someone is HPV positive, they can pass on the virus to others. In most people, the HPV infection clears after a short period, but in a small number, the infection persists and can progress. Over the course of 10 to 30 years, the viral load can increase alongside changes that develop in skin cells, so that their growth becomes increasingly disordered and eventually cancerous. These changes are not usually visible to the naked eye before the cancerous stages. Other major risk factors for oropharyngeal cancer are alcohol and cigarettes, as well as some plants such as betel leaf, which is chewed with tobacco in parts of Asia, and mate, a stimulant drink popular in South America. Here, visible changes are similar, but the disease process driven by HPV is entirely different to that of these other carcinogens. There are a number of signs and symptoms of oropharyngeal cancer, many of which are common complaints we all experience and which can be completely normal. But when they are unexpected or fail to resolve after a long period or treatment, it could be a warning sign. The red flags to look out for can be subtle, such as persistent sore throat, numbness, pain, or difficulty swallowing or moving the jaw, earache, and bad breath. Or there may be more noticeable signs, like persistent and sometimes ulcerated enlargement of one tonsil, and asymmetry of the tongue base or any obvious tongue base lesion. It is important to recognize that any of these symptoms are more worrisome if they are restricted to one side, as this is characteristic of oropharyngeal cancer. But, just as with the initial HPV infection, there are often no symptoms at first. Many people only visit their doctor when they experience the later effects, which include painless, firm swellings in the neck and unexpected weight loss. Despite this, it is helpful to remember that those affected by HPV-positive oropharyngeal cancer tend to be younger and are more likely to be male than with non-HPV-positive oropharyngeal cancer. As always in health, at every stage in this timeline, the best approach is prevention, whether that means avoiding HPV infection, research into screening and vaccination, or early detection and treatment of oropharyngeal cancer. HPV and oropharyngeal cancer. Know the risks, spot the signs.